Now let's welcome our first guest, who was also a speaker and sponsor at our Dallas event coming up, Brian Dudzik, Business Development Lead at Bloom Health, one of the leading private exchange platforms. Brian, good morning.
Hey, good morning. How are you doing?
We're great. Nice to have you on the program. How are you doing?
Doing great. Thank you so much for having me, and look forward to the event next week. It should be exciting to meet a lot of the folks that are interested in the private exchange market, and really just to kind of get an understanding from an industry perspective, where things are at and where things are moving, what the mindsets of our broker consultant partners and employers as well.
Yeah, I think it's an exciting time in this marketplace. That there's a lot of pin up, what I call need to know. People are trying to scratch their head and say, should we, could we? If so, what should we? But talk a little bit before we jump right into kind of talking about the middle market, which is one of the panels you're going to be showcased on, Brian. Give our audience a little background on Bloom Health, please.
Sure. Well, so Bloom Health is a private exchange technology company. We're based out of Minneapolis, Minnesota. Founded early on 2009, was really one of the pioneers in terms of a private exchange solution that we rolled out to the market. Over those past 6 years, we have evolved a lot, and I think that's kind of indicative of what has gone on in the private exchange market as well. Year over year, month over month, it has evolved. So we have evolved with that growing need from our partners and employers. We currently work with 7 different health plans across the country. Some of the largest health plans in the country are our partners, and we private label our solution for those health plans as they go out to market their private exchange solution. I primarily work with one of our large health plan partners on the East Coast and work with their sales and account management teams day in and day out to get a better understanding of, from their clients' perspectives, what they're looking at doing, where they're looking at in terms of private exchange, if that's a road that they want to go down, and how do we start to facilitate that transition where the market is starting to go. And I heard you talk a little bit earlier how it's kind of initially we saw a lot of interest in things and potentially have started to subside, but I think that the interest is already there. The people are starting to move forward, and I think that you're going to all see that gradual increase in interest and adoption as we move into 2016, 17, and 18.
Yeah, I think you're right, Brian. I was on a webinar recently, and out of the large audience that we had on that webinar, I think a key number was, 64% of the benefit lead, executives on that webinar said they were trying to figure out whether an exchange was right for them. That's a big number. That's not saying they're not saying no to exchange. They're saying, hey, they need to figure it out, and very interested in figuring it out. So talk a little bit about the middle market, which most of us predict is going to be one of the fast-moving markets. So tell us what you see in the middle market, and why you would see their interest in a private exchange solution.
Sure. Well, when you look at the middle market, and we've all seen over the past few years Accenture provide their year-over-year study on the growth in private exchanges and their predictions of where the growth is going to be going in 2016 and 17. And what was different about what they mentioned in their survey last year was that they saw initially you had a lot of growth and adoption for private exchanges on, the very large jumbo employer market, so those national accounts, 5,000 employees and above. And then you also, saw that more in the small group market, the 100 and below. But then when you look at moving in 2016 and 17, you really are seeing that growth and adoption going to be happening in that middle market. So, and I kind of define the middle market as, maybe 100 employees to a couple thousand employees. Mm-hmm. And really, those employers are looking at a private exchange solution, I think from three different aspects. They're looking at it, one, from, does this help in terms of a cost perspective? Two, from an administrative perspective, knowing that the administration of benefits year over year is becoming more and more complex. So does moving to this type of solution help ease that administrative complexity and ease? And then also from a compliance standpoint. So when you look at things like the ACA reporting requirements that all large employers have to do for the IRS and for plan year 2015 and going forward, does a private exchange solution bring those type of compliance services into the solution? So when you look at those three things, the middle market is really now starting to say, you know what, I've heard about private exchanges 2 years ago. I learned more about them. They're evolving. My needs are evolving. Now I think is the time really to start to take that leap forward. So I think that's what you're starting to see in that middle market.
And for the middle market, Brian, that's primarily single carrier models, right? For the middle market, is that correct, or how do you see that?
Yeah, I would see that. So when you look at the middle market and the private exchange solutions out there, the carriers that we work with, and I think carriers in general, feel that in order to provide, be a part of a private exchange solution in that market space, that they would rather have that as a single carrier solution. It isn't really till you reach a much larger group size that the carriers are wanting to be a part of a multi-carrier solution. And what I mean by multi-carrier solution is more of an offering where an employee has the choice between 2 or 3 or 4 different medical carriers. But what we are starting to see as well is carriers are saying, you know what, if I'm the single carrier in this geographical location, but there may be another medical carrier that houses another part of that employee's population. So you may see multiple carriers, but you may not necessarily see in that middle market multiple carriers competing for that member's business.
Yeah, and then the mid market employer and their advisors can really focus on surrounding that single carrier health plan with some of the other voluntary supplemental health and some of the other emerging parts of an exchange like telehealth and transparency and et cetera. Correct?
Yeah, so when you're looking at it, knowing that it's going to be with a single medical carrier, and we've all seen the statistics out there when an employer is going into a private exchange solution, they're going into that solution and are going to be having more plan choice. So from prior to, they may have had 2 or maybe 3 plan offerings. They now may have 6 plans, 8 plans, 10 plans, depending on the solution that they're going toward. And what you're seeing, the data from all of the private exchange vendors, for the most part, is roughly about 2/3 of the employees that go into a private exchange and now that are getting expanded choice options from a medical perspective, they're buying down coverage. So they're buying down from potentially a $1,000 deductible plan to a $2,500 deductible plan. So with that, that means that employee has more risk. They have more skin in the game. So how, from a private exchange perspective and an employer perspective, do you build a solution to say if you're going to potentially buy down coverage and have more risk exposure in terms of deductible amounts, how can you supplement that with other lines of coverage, such as, voluntary products as well? And then from a medical perspective, how do you look at adding in some of those things that are going to help that employee better choose care, access care, so it could be wellness programs, it could be telemedicine program, it could be getting a little more strategic in terms of the plan designs. Maybe you want to see if that carrier is offering an ACO option or a more narrow network option that helps kind of better medically manage that member and provides them with a much more aggressive premium for that plan that they're buying.
Yeah, that makes a lot of sense, Brian. Ron, you got a question for Brian?
Brian, can you give our audience a little bit of an idea of the types of carriers that are in your network, regional, national carriers, and if people are tending to select one over the other, and for what purposes might they be looking at a regional versus a national carrier?
So Bloom Health primarily partners with our health plans in a single carrier model. So the carriers that we have as part of the Bloom Health platform, and all of these health plans private label their solution out in their particular marketplace. So you look at Anthem, one of the big 3 or 4 right now, but going to be big 3. HCSC, which is Blue Cross of Illinois and Texas, Blue Cross of Michigan, Blue Cross of Minnesota, and then Medica. So I'll talk specifically about the Blue Cross of Minnesota and then Medica, because they're both in the same geographical area, and we provide the same solution for them. And they're competitors at the end of the day, where we're providing them a single carrier solution, but they're competitors. So you look at, what are those two organizations doing? So you look at someone like a Medical or other regional health plans that are going up against, the big managed care organizations, whether it's United or Aetna or Cigna or Blue Cross plan. You're seeing the regional health plans starting to want to take a little more creative approach to their private exchanges. So we do have an active ACO model built for our plan with Medica, and they found that to be very successful. We launched that in 2012, and they went out and worked with 6 of the strongest hospital systems in Minnesota and built an ACO network. And from that, they have exclusively provided that ACO option through their private exchange. So now that is a differentiator that a Medica is going out to market and talking with their potential brokers and employer groups about going to them rather than going to another carrier. And I think that as carriers start to look at, year over year starting to evolve their solution, they're starting to see more and more what is going on in the market, and they're making their adaptations more quickly and wanting the Bloom Health and the other private exchange solutions say, how can we take this strategy? How can we do this and incorporate that into the solution that's going to make it a much more user-friendly experience for our members?
Brian, we've got about 2 minutes to go. I want to ask you a quick question about advisors and then have you kind of close some takeaways.
Sure.
With the middle market, advisors are pretty key and pretty essential. Is that also one of the barriers, they getting caught up with their knowledge level of an exchange model, et cetera? I mean, we've got a ton of advisors joining us in Dallas. I think that's one indication they're trying to get their arms around this.
Well, the funny thing is that when you look at and I assume when you say advisors, you're talking about the broker consultant market.
Yeah, Brian. Yes, I'm sorry. Yes.
Yeah. So from the broker consultant market, we look at them as an advocate, for our exchanges, through our health plans, and it is an evolving market. At the end of the day, really, a private exchange is just the kind of technology solution that's going to help facilitate the enrollment of the benefits. So the brokers and consultants could look at the exchange model and see, one, they are still going to be really a part of this solution. They have to help out in determining what potentially is the best technology, the vendor to use, but also to help kind of create and strategize with their clients. The plan designs around that, how that is going to function, how are we going to help best communicate and educate to the employer and also the employees about this. So the broker and consultants are still an integral part of this. And then as you see, as I talked about earlier, that you're seeing that more employees that go into a private exchange are buying down coverage. It's going to be key for that broker and consultant to be working with that employer to get a better sense of how do we then start to bring in those other products and solutions and ancillary products that are going to help round out that package. It's almost like when you look at employers, before, as when they were not in a private exchange, they were providing this one piece of big whole pie, and now they're going into a private exchange. That whole pie is still there, but it's just cut up into pieces, and it's up to that employee to be able to choose the pieces that they want. So the broker and consultant community is still really a big part of this, and they're really the driving factor in terms of growing this out in that middle market.
Right, and they have to get by the fact that they may look initially at a loss of commission on the major medical part, but there's an expansion of income opportunities through the complete experience, right?
I definitely would say that. I have a number of broker consultant friends throughout my time in the industry that have built up their own private exchange solution, and they've actually seen their revenue grow a lot over the past few years, primarily because of the revenue coming in from those ancillary products. They may in prior years been solely focused in on the medical side of the house and didn't necessarily focus in on the other products and services that come along with incorporating a full service benefits package for an employee. But then they're starting to see that those and more products more and more are gaining an interest, and there is a lot of revenue to be made. So at the end of the day, I think the broker is made whole and then even be able to grow their revenue as they look at moving to a private exchange solution for their clients.
Yeah, that's good, Brian. Leave our audience with a couple takeaways, and we really appreciate your time on the program today.
Well, yeah, and I appreciate the time as well. The one thing that I would say in terms of the private exchange market and the upcoming conference is that it is a very dynamic market. I mean, really, private exchanges came on the scene in 2011, 2012, and year over year, month over month. I mean, there is a lot of change going on there. From where things were at just a few short years ago to where things are at now to where things are going in a couple of years, it is definitely a dynamic solution that is happening. And I think that the interest and the growth is going to continue to happen more and more. So I'm very excited about it and look forward to joining everybody in Dallas next week.
Thanks, Brian, for your time, and we will see you. We'll see you soon. We'll see you Monday or so in Dallas, Texas.
Thank you. Have a great day.
Take care, Brian.